knowing that like their whole world has changed. That's always just one of the most special moments of this job.
Hello, how you going?
Hello.
Hey.
All right, let's go. Being someone's everything on a day that might be their worst, and being able to have the knowledge, the experience and the care to look after them on that day. That was really what sort of called me into nursing.
Midwifery is really around woman-centred care. So we are really caring for women during one of the most vulnerable time in their life. We're with women during the highest of the highs and also with women and their families sometimes during some of the lowest points of their life.
I think we're the only profession that deals with the lifespan. So, being an emergency nurse by trade, we looked after babies that were born in the emergency department. And I think probably my oldest patient was 101 years old. So I think that's what makes nursing really special.
You can see children go from being sad, upset. You provide them with some pain relief, or you provide them with a little toy and a little bit of joy, and the smile that it brings their face just makes your heart sing.
I don't really have like a big story to tell. I just do it because I want to do it.
So when I catch a baby and then pass Bubs to mum for the first time, it's just incredible knowing that like their whole world has changed, and just being able to be a really small part of it is just really special.
I chose Monash because it offered the double degree of nursing and midwifery, and it's also one of the best universities in Australia, especially in terms of healthcare.
I like to think of it as a bit of a home away from home. We have students that come and knock on our offices. We have lots of debrief and chats with our students and really get to know them on a really personal level.
I came in and felt like I found a whole environment. I didn't just come in and find a classroom, and I think it was that whole holistic picture that really was the thing that stood out to me about Monash, and it's one of the reasons that I never left.
The degree is super hands-on, and it involves you from week one in practical simulation labs.
My first hands-on experience was pretty interesting. We had to learn how to take blood glucose levels. So they gave us these fake thumbs that were filled with blood inside of them.
No, I was terrified to do my first injection, but getting to practice in the simulation labs here on mannequins takes some of that scary edge off.
It brings me great joy when I see a Monash student appear in the workplace. It's always great to see them on placement and seeing them do so well and be confident in the way that they care for their patients. And that's a real credit to the academics here at Monash.
Those friends that I made during the course I still catch up with now, and as much as we cheered each other on during uni, we still cheer each other on and celebrate each other and what everyone's doing. So whenever I see someone that I went to uni with on the ward, it's always just the best day.
If you're considering studying nursing and midwifery at Monash, I would say definitely go for it. Especially just coming out of year 12, I know that a lot of people are in the same boat as me, and I'm only 7 weeks in, but I know that I've definitely made the right decision.
If you're thinking about being a nurse or a midwife, you're already clearly someone who works well with people, and the fact that you're thinking about it probably means that you'll probably do quite well in it. So just give it a go.
I've felt supported the entire time, and that I've really made the most of my time here.
I've loved every minute of the career that I have had, the opportunities that I've been fortunate to have, and as well as all the skills, the connections and people that I've met along the way.
Being able to work with people in caring for them when they need it was all I ever wanted to do, and I'm glad that it's been as good as I wanted it to be.